a tendency at times to think that the priest is the one who's being paid to do the ministry. So why should lay people get too involved in the ministry of the church? And there's an equal and opposing tendency to lose sight of the unique role of the ordained priest in the community. When you think about your ministry, your professional vocation, and your involvement in the church, what relationship does the clergy, do the priests have, or can the priest have, with your particular lay ministry? Is this the ministry you think a priest should do, or could do, or would do? What is the relationship between your vocation and the ordained ministry?
Well, I think some priests could, but most priests are not early childhood professionals. Nor should we expect them to be. We expect the priest to be the one-man band. It's just not fair. That's why he has us. We're the laity. It's our job to serve the priest and to serve the body of Christ, the church. So we have to do our share. And yes, of course he has a role. He has a big role because he's standing in the place of Christ. And he comes, in my particular place, he comes into the children's room and meets with the children and creates a wonderful relationship with them. And even though he doesn't teach the way we do, it's okay because it's his relationship with the children, that's all that matters.
So you have a special, unique body of knowledge that the priest may or may not have, and doesn't need to have, but the priest's role is one of presence and he's involved, and one of relationships. So it's not separate, but it's distinct and within his particular priestly ministry.
I couldn't do it without the priest's support, and I wouldn't want to either. I go to him for counsel and advice and approval as well.
So the priest serves a critical role in enabling you to do your lay ministry, although you maintain a distinct expertise in collaboration. Beautiful. Others, what's the relationship? You're on.
So, like Catherine was saying, I think too, at the monastery, things have, we've started to do a little bit of hospital ministry, which is interesting because, well, first of all, we're less than 2 minutes from the hospital, that I think 5 parishes share that hospital. So there's always a Greek Orthodox patient in the hospital. And of course, the Greek priests are so overburdened that they don't often have time to drive 20, 30 minutes to the hospital to see the parishioner. So they will ask us to visit, which is also another interesting development because we discovered that there's a strange mentality among elderly ethnic people that if a priest visits you in the hospital, it's not a good sign. But nuns are fine. So we've actually, the priest will even ask us, this parishioner doesn't want to see me, but will you go, chant with them, say a prophecy, something, so their time in the hospital will pass.
It's almost preferred sometimes.
Yes, it is.
And it's a collaborative ministry. Beautiful. And you're also saying, if I could add, that logistically a priest can't be present in all places and filling all things.
Exactly.
But that together with all the lay people, we can.
It would be a nice thing for, I always tell the priests it would be nice if they could organize teams of women to go visit these people because sometimes we can't go to see the person. If they're only one day there and it doesn't work out in our schedule, we can't either. So it would be nice to have a team of lay people that could just go to the hospital and make sure that all the Orthodox patients had a visitor that day.
Would anyone else like to say something about the role of the clergy?
I could just say that the connection between clergy and mental health providers is developing, but I think it's underdeveloped and something that could provide a vital link for the kinds of pastoral situations that require a greater level of clinical knowledge and containment. That my experience of the Greek Orthodox clergy is that they're fantastic pastors and can catch all kinds of and react to and respond to all kinds of crises but the kind of work that gets done in psychotherapy, where it's regular, it's weekly or every other weekly, and it's based around a kind of knowledge of human behavior that we just don't get in seminary. To have a good linkage between priests in the community and mental health providers in the community is a huge pastoral care service.
And in many ways, it parallels the child development, that you provide a unique expertise that a priest may not have, but it's in collaboration with and kind of almost under the guidance of a priest who's present and involved. Is that right?